Older adults, 10 reasons why your legs weaken after age 50. Have you ever noticed that climbing stairs, once effortless, has turned into a challenging task as you've aged? You're not alone. After the age of 50, many of us begin to experience a noticeable decline in leg strength and mobility. But this isn't an inevitable part of aging. In fact, the power to change this path lies in your hands and your legs. Strong legs are the foundation of active aging. They not only help us move, but also thrive and remain independent throughout the later stages of life. Ignoring weak legs can lead to reduced mobility and a higher risk of falls. These are serious concerns as we grow older. However, addressing this issue with effective strategies can greatly improve your quality of life. This guide is designed to enlighten and inspire you, with practical, actionable tips to help strengthen your legs and regain vitality. Let's begin this journey to understand what causes leg weakness, and explore powerful steps you can take to prevent it. Get ready to shift your mindset around health, and move forward with confidence and strength in every step you take. Before we begin, I'd love to know where you're joining me from today. Leave a comment below and feel free to ask any questions you may have. First, let's talk about age-related muscle loss, also known as sarcopenia. As we get older, our bodies naturally go through changes that can impact our physical abilities. One of these changes is the gradual loss of skeletal muscle mass and strength, a condition called sarcopenia. This process can begin as early as your 30s, but it becomes much more noticeable after age 60. Muscle fibers decrease in both number and size, and your body replaces muscle tissue more slowly. The result is not just a loss of muscle mass, but also reduced strength and function, which can seriously affect daily life. This can lead to slower movement and a higher risk of falls and injuries. Understanding sarcopenia is crucial, because it highlights how important it is to preserve muscle as we age. The good news is, sarcopenia doesn't have to be an unavoidable part of aging if you take proactive steps. For example, regular strength training is one of the most effective ways to fight muscle loss. Engaging in exercises that challenge your muscles can help maintain their strength and function. Simple tools like resistance bands or light dumbbells can be used at home to stimulate muscle growth and boost endurance. In addition, nutrition plays a vital role in muscle health. A protein-rich diet supports muscle recovery and growth. Older adults, in particular, need higher protein intake to counter the natural muscle loss that comes with aging. Including lean meats, eggs, dairy products, and plant-based proteins like beans and lentils in daily meals can make a significant difference. The second reason is peripheral neuropathy, nerve damage that affects the legs. Peripheral neuropathy is a common concern among older adults, especially when it affects leg strength and coordination. This condition happens when the peripheral nerves, which transmit signals between the brain, spinal cord, and the rest of the body, become damaged. Common culprits include chronic conditions like diabetes, or deficiencies in vital nutrients such as vitamin B12. In diabetic neuropathy, prolonged high blood sugar damages the nerve fibers, especially in the legs. Symptoms can include pain, tingling, numbness, and severe weakness, which affect mobility and balance. A lack of vitamin B12 can cause similar symptoms, and may lead to serious nerve damage if left untreated. Older adults, especially those with dietary restrictions or absorption issues, are more vulnerable to B12 deficiency. Preventing and managing peripheral neuropathy involves a proactive approach, including treating the underlying conditions and improving nutritional intake. For those with diabetes, tightly managing blood sugar through diet and lifestyle changes is essential. This control slows the progression of neuropathy and can help reduce its symptoms. Regular doctor visits, routine blood tests, and staying physically active all play a key role in effective management. Nutritionally, it's crucial to get enough vitamin B12, especially for older adults. For those who don't absorb it well, B12 supplements may be necessary. Foods rich in B12, like meat, dairy, and fortified cereals, should be part of your daily diet. Regular B12 level checks can catch deficiencies early, and timely supplementation may restore proper nerve function. The third reason is peripheral artery disease, or PAD. PAD is a common yet often overlooked condition that mainly affects older adults. It reduces mobility and independence by limiting blood flow to the legs. PAD happens when plaque builds up in the arteries, narrowing the pathways for blood to flow. When you walk or move, your leg muscles don't get enough oxygen-rich blood, leading to pain, cramps, or heaviness. This is called claudication, and the symptoms usually improve with rest. Managing PAD requires a comprehensive approach, from lifestyle changes to medical support. Quitting smoking is absolutely critical, as smoking rapidly worsens PAD and artery health. Controlling blood pressure and cholesterol through diet, exercise, and medication is also crucial. This helps slow the progression of PAD and reduce its symptoms. Exercise, especially walking, is extremely beneficial for people with PAD. Joining a supervised exercise program can improve blood circulation and increase how far you can walk without pain. These programs usually begin with light walking, then gradually build up distance and intensity as endurance improves. The discomfort during these exercises isn't harmful. It shows your body is adapting and blood flow is improving. Regular checkups with your healthcare provider are essential to adjust your PAD treatment plan as needed. The fourth reason is a vitamin D deficiency. This is a common issue in older adults that significantly affects muscle strength and increases fall risk. Vitamin D isn't just important for bones, it also plays a major role in muscle function. As we age, our skin produces less vitamin D from sunlight, and our kidneys become less efficient at converting it into its active form. A lack of vitamin D can lead to weak leg muscles and a higher risk of imbalance or falls. This makes everyday activities like climbing stairs or walking on uneven ground more difficult. Preventing a vitamin D deficiency is absolutely doable. Getting 10 to 15 minutes of early morning sunlight a few times a week can help maintain healthy vitamin D levels. However, older skin produces less vitamin D, so sunlight alone may not be enough. That's why dietary sources of vitamin D are also important. Fortified cereals, milk, orange juice, fatty fish like salmon and mackerel, or egg yolks are all great sources. For those who can't get enough through diet, vitamin D supplements can be a highly effective option. The fifth reason is a sedentary lifestyle. This is very common among older adults, and it's a major factor in weakening leg muscles and overall physical health. The phrase "use it or lose it" couldn't be more true when it comes to muscle strength. When we stay inactive, muscles shrink and weaken over time. This not only limits your mobility, but also raises your risk of falls and loss of independence. The good news is, this decline can be prevented by moving more every day. Simple, enjoyable activities like walking, swimming, or Tai Chi can make a big difference. These exercises are easy on the joints, yet still help maintain muscle mass and improve heart health. Walking is a great way to engage multiple muscle groups and boost circulation. Swimming tones muscles without putting stress on the joints, making it ideal for those with arthritis. Tai Chi, often called meditation in motion, improves both balance and mental well-being. Adding these physical activities into your daily life doesn't have to be hard. Even small changes can bring big health benefits. For example, you could start with short walks, like walking to the store instead of driving, or taking a light stroll after dinner. Joining group classes like water aerobics or Tai Chi is good for your body and helps you stay social and motivated. To make physical activity a lasting habit, set small, achievable goals at first, then gradually increase your time and intensity as your body adapts. Remember, the most important thing is consistency. Staying active regularly helps slow down muscle loss, maintain strength and flexibility, and lower your risk of age-related chronic diseases. The sixth reason is osteoarthritis, also known as OA. It's a common cause of leg weakness in people over 50, especially affecting weight-bearing joints like the hips and knees. OA happens when the cartilage that cushions your joints wears down over time, causing pain, stiffness, and reduced mobility. As cartilage weakens, joints become less flexible and more prone to stress, leading people to avoid movement, which further weakens muscles. To prevent and manage OA's impact on leg strength, you need a combination of treatment and lifestyle adjustments. Low-impact exercises like swimming, biking, or water aerobics are especially helpful. These workouts are easy on the joints, while still building muscle and improving range of motion. Strength training is also essential. Exercises like leg presses, squats, or lunges can be adapted to match your ability. In addition to exercise, medical treatments play a key role in managing osteoarthritis. Consulting your doctor can guide you to the right treatment options, such as anti-inflammatory medications, corticosteroid injections, or even joint replacement in severe cases. The goal of these treatments is to manage pain and restore joint function so you can stay active. Once your pain is under control, it becomes easier to stay motivated to exercise, helping you maintain long-term strength and mobility. The seventh reason is medication-induced myopathy, a commonly overlooked cause of leg weakness in older adults. Certain medications can have side effects that weaken muscles, and this is often mistaken for normal aging. Statins, commonly prescribed to manage cholesterol, are a well-known example. While highly effective for heart health, some people on statins may experience muscle pain or weakness. This condition is known as statin-induced myopathy, and it can significantly impact mobility. If you're taking medication and notice unusual leg weakness, talk to your doctor. Reviewing your medications, including adjusting the dose or switching to a different one, may help reduce side effects. For example, if statins are causing issues, your doctor might suggest a different cholesterol medication or a more suitable dosage. Beyond statins, other drugs like corticosteroids or chemotherapy medications can also lead to muscle weakness when used long-term. The goal isn't to stop important medications, but to optimize your treatment in a way that protects your muscle health and mobility. The eighth reason is osteoporosis and fractures, a serious health issue among older adults. Osteoporosis happens when bones become weak and brittle, increasing the risk of fractures even from minor bumps or falls. Fractures in the hip, wrist, or spine can limit mobility, leading to prolonged bed rest and rapid muscle loss. This creates a cycle. Weak bones lead to fractures and weak muscles make recovery even harder. Preventing osteoporosis is key to protecting your mobility and independence as you age. A diet rich in calcium and vitamin D is essential for maintaining strong bone density. Calcium helps build strong bones, while vitamin D supports better calcium absorption. In addition to nutrition, weight-bearing and strength training exercises are crucial for keeping both bones and muscles strong. The ninth reason is obesity, and especially sarcopenic obesity, a dangerous but often overlooked condition in older adults. Obesity puts extra strain on weight-bearing joints like the hips, knees, and ankles, increasing the risk of pain and injury. Meanwhile, sarcopenic obesity is when excess fat replaces lean muscle, leading to weaker, more fatigued legs. The combination of excess weight and muscle loss makes movement harder and worsens overall muscle decline. To improve this condition, you need a well-rounded strategy that combines healthy eating with appropriate physical activity. Your diet should be low in saturated fat, high in protein, and calorie-controlled, to support weight loss while preserving muscle. For exercise, combine cardio like walking or swimming, with strength training using resistance bands or bodyweight moves. The key is consistency, so your body can adapt and improve over time. The 10th reason is stroke, also known as a cerebrovascular accident. It's a serious health concern, especially for people over 60, affecting not just the brain, but also weakening mobility, especially in the legs. A stroke happens when blood can't reach part of the brain, causing brain cells to become damaged within just a few minutes. If the part of the brain that controls leg movement is affected, you may lose muscle strength, have trouble walking, or even experience paralysis on one side. Stroke recovery focuses on regaining strength and mobility, including physical therapy, gait training, and using assistive devices if necessary. While this process may take time, many people significantly improve their mobility with consistent effort. Stroke prevention is absolutely critical, especially for older adults. Managing blood pressure is the #1 priority, since high blood pressure is the most common cause of stroke. Avoiding smoking, managing diabetes and atrial fibrillation, and sticking to a low-sodium diet also helps significantly lower your risk. Now that we've explored the many different factors that can affect leg strength and mobility as we age, it's time to take action to protect your health and independence. Starting today, pick one or two of the tips we discussed, and start adding them to your daily routine. It could be light strength training, adjusting your diet to include more protein, or checking in with your doctor to manage underlying conditions. Small, consistent changes can make a huge difference in the long run. And remember, you're not alone on this journey. Share your thoughts in the comments below, and don't hesitate to ask questions. I'm always here to help. If you found this video helpful, hit subscribe to Health 365 for more valuable health tips for older adults. Together we can make every step in life stronger and more vibrant.